is like, is that better that it's
yeah,
like
yeah,
that?
no, it's good.
Okay.
Perfect. Okay. So
No, I can see something you can't.
he has a different.
Oh, okay.
Different angle,
Oh, I'm
so
sorry.
That's all gone bonky.
Okay.
Right. Okay.
We don't want your hair to be bonky.
No, as long as I don't see this, I'm cool.
We are rolling.
Okay, so if you just start by telling me your name and what you do, you know, what your title is and what your responsibilities are.
Okay, so my name is Rakhi Singh. I'm a family physician. I'm a doctor that works in this clinic, and my role is I serve my patients who are adult patients in San Mateo County.
Okay, so I'm going to ask you to say that one more time. Only say the Fair Oaks Clinic. Is that what we're calling it?
Fair Oaks Health Center. Okay,
Fair Oaks Health
thank you.
Rocky,
Yeah.
When you were talking
Yeah.
before, you were talking much louder. You've gone all
Yeah.
quiet.
Oh, okay, because I'm trying to be serious, and I'm not a serious
You
person.
don't have to be serious.
Okay.
No,
Serious
be
and loud.
yourself. You have like the most beautiful smile.
Oh,
Just
thank
do
you.
it. Yeah.
Okay, we
Okay.
are rolling
Yeah.
and action.
Yeah.
So my name is Dr. Rakhi Singh. I'm a family physician, and I work at the Fair Oaks Health Center. I've worked here for about 5 years, and I serve adult patients in the county.
Perfect. And we're going to be talking, we're just going to be doing the overview for LEAP, and as you know, the purpose is to help people who don't know anything about LEAP to understand what it is. So I think what I'd like to ask you is if you were to describe LEAP to somebody who didn't know a thing about it,
Thank you.
How would you describe it? Like, what would you say about it to, say, a coworker or another staff person?
So I would describe LEAP as a systemic way to continuously improve a system of work. So, and I would describe it as I'm having trouble.
It's okay. You can just start over this video.
Okay.
Just cut this
So.
out,
So I would describe it to a colleague as a systemic way of improving systems that we provide. So it's basically a way for the staff that's engaged to really look at the processes the services and processes that we provide to our patients and make them more efficient, smarter, faster, more effective. And really a way to give our patients more value than we are before. And one of the key features is that we are consistently improving, and we're really using the feedback of our staff to do it. The whole point is to really use the knowledge and wherewithal of the staff to make things better, and that the changes come from the workplace and not from an office somewhere removed or not by an administrator.
Okay. So I'm just holding on you for a moment afterward just to give us a couple of seconds of space. So when did you start using LEAP, and what was the first thing that you worked on?
So about 2.5 years ago, my supervisor started talking to me about LEAP, and she was, learning about it, getting trained about it, and she approached me, and I was really excited because it just seemed like a really smart way to make things better for our patients and for the staff. And so I was interested in learning more about it, so I started a training program so I could learn about it. But when I really first applied it was the building that we're sitting in right now is called Fair Oaks Health Center, and it's a merger of 3 separate clinics into one new building. And the first time we used I used LEAP processes was in the planning of this building. And so leadership from all of the 3 clinics came together, and we tried to design this building using LEAP principles in mind, all with the goal of giving our patients more value and giving staff a better, smarter way to do their work.
How do you think that made a difference? I mean, if you hadn't used LEAP, versus that you did use LEAP, how do you think it improved the process and made this possible?
So I think, first off, it's a daunting task to merge the way 3 clinics who've been existing for decades work together. So LEAP was a great way for us to start to standardize some of the work we do, which we realized was going to be really important. This building was going to serve newborns, and it was going to serve the elderly. It was going to serve people with eye issues and dental issues, and streamlining that process, we used a lot of LEAP strategies, and one of the key ones was standardization. So that was really important. But we use it as an opportunity to use some of LEAP principles to streamline processes, to make it so that we were more efficient at seeing patients. We made it so that teams, a provider and a nurse that work together, instead of being situated really far apart, we actually set up the workstations where we're sitting next to each other, which is better communication and flow for our patients and less chance of error. And we were able to really utilize the space smartly. One of the best examples is that in each of the 3 clinics, we had supply areas that were rather large. And when we went through them, we saw that there were things that were expired, large closets full of bandages and things that really we didn't use that much of. No one was really watching as well what we were doing. And now in the new clinic, using LEAP processes, we really have it streamlined where there's a small closet that supplies a whole area where we see patients, and that supply is replenished, and that allows more space. So we're able to embed like mental health services, maybe an extra patient room, an extra procedure room. So this is just a better way of serving our patients.
Okay, can we just cut for a second?
Yeah, what is that noise?
Rolling.
Okay.
Do you want to do a little bit of that one again? Because that hair was driving me crazy. I wanted to stop it, but you were doing great.
No, I can go back and
Okay.
probably could do it better, hopefully. the
Okay,
next
so
time.
so she's talking about the 3 clinics coming together. I mean, that's a good example, right?
It's a really good example.
Okay,
Okay.
sure. So basically, I was asking you, how you think it made a difference and how it made it possible for these clinics to come together and to create all that you have.
So start
created.
kind of from the beginning.
Yeah, I guess
Okay.
so. Do you want to start from the beginning of that?
Well, whatever you're comfortable with. That was a long answer.
I know,
Yeah,
I'm
you
sorry.
could do like you could shorten it
Okay.
and
Yeah.
do a shorter answer
Okay.
version.
So, the building that we're sitting in right now, the Fair Oaks Health Center, like I said, was 3 buildings that merged into one. And so it was a pretty daunting task. And we really used LEAP principles to that actually is what made it happen. We started to standardize a lot of the work that we did. And these 3 clinics have been existing in decades, and they were doing things very differently. And so one of the key LEAP principles we used was standardization of the work. We also used LEAP principles to help design the building, which was a pretty unique thing to do. We were able to design the physical workspace to make it so that flow was improved and efficiency was improved for our patients and for our staff. Small things like making seating areas where a nurse and a provider can sit next to each other and work as a team, we found to be really helpful. We also were able to save space in the clinic, which was really helpful in terms of providing other services. So we were able to shrink the area needed to provide supplies for a given floor, because we really were able to see how many supplies a patient room takes and put it closer to the area where it's needed.
Okay, great. Now, when you mentioned standardization of work, can you give me maybe a couple of examples of a particular type of work that was standardized by using LEAP that wasn't before that?
Sure. So, and this goes to patient safety, which is very important to me. It's very important to all the providers here. When patients were seen and left our clinic, we would give them a set of instructions. And ideally, we would print out the instructions and give it to them so that they could remember what medicines to stop, what to start. And it wasn't happening all the time because people were busy. Simple things like a printer being too far away was a big barrier for people. But we all the while knew it was really important for patient safety, so they knew what their medication list was. And so using LEAP principles, a team of my colleagues and front desk staff came together, and nursing staff, and they devised a step-by-step process of how to do this. And they timed us doing it, and they really made it as efficient as possible, even putting a printer near the nurses so they could grab the paper. Small changes like that. And we track to see what percentage of patients are going home with that piece of paper, which is really helpful. For most providers, it's at or above 90% now. And I think that's a great thing. It makes things better for patients.
So after doing that, have you noticed a difference in patients complying with the instructions? I mean, how has that, improved patient health and anything else that it improved? That you can talk about?
One of the first things we see is that we tell them, okay, you're going to stop this medicine because it's not working. I'm going to put you on something else. And they say, yes, yes. And then we give them we show them on the screen, and then they get the paper. And then sometimes, maybe 5 or 10% of the time, they look at it and they said, no, I really didn't understand what you were saying. And that's so important, because I may not see them for 3 months, and they may start taking the wrong medication or not understand that I'm increasing the dose or changing it and take 2 things that they shouldn't be. So right after we give them the paper, we can see that we didn't do a good job of explaining it, and we go back and with my nurse and myself, we try to make sure that they really can be empowered to take care of themselves. So it makes a difference.
That's great. Let's see. I think that's really good. I mean, do you have anything else that with Jean and...
The only other thing that I would say, because I know the other people who've interviewed are admin people, or people who make big decisions, and I'm someone who's more on the front lines. I don't run anything, but right. I really believe in the LEAP principles. One of the best things... Could you say that
again?
Oh.
Because there was a loud noise.
Oh, yeah.
Right over it, yeah.
Oh, yeah. So I really believe in the LEAP principles. And as someone who's on the staff and who's front lines and who doesn't run a thing, I would say there's a hidden benefit to this. It really improves staff morale. When you have people who are normally the big wigs that make decisions, saying, you know what, we trust you as a staff to really look at what you're doing and make it better for yourselves, there is an empowerment that happens in the staff that I haven't seen in my 5 years of working here. People really feel vested in doing things better and better, and they feel like the decisions that are made by them or their colleague, not someone telling them from the top down. And it's really fun to see. And when we have Kaizen events where we're all sitting together and working on a certain process, one of the first rules is that your title is thrown out the door. And that's uncomfortable in the beginning, but you can have someone who just works in their little area with the chief medical officer working together to make a process better. I think that's amazing. It makes me really happy to work for a place like that. So I just wanted to add that, because I really believe that.
Great.
Yeah.
What would you say to somebody who has been asked to join, just do this a little bit. Okay, that's cool. All right, just one here. What would you say to somebody who's been asked to join a LEAP process? And they were saying, well, I'm really nervous about this. What are they going to think? What if, what would you say to kind of make them feel relaxed about it or encouraged?
I would tell them that they're there for a reason. They were asked to be there because of the work they do, and their everyday work is what's going to best prepare them for the week ahead. And that the knowledge that they have obtained through just their daily work is what we call expertise. And nobody else in that room is going to know how to do it better than them. And so they're going to be in for a really great week, and you get really comfortable with the people that you're working with. And they're often people that you would have never interacted with. You may have seen their name on an email, but what comes out often are really good friendships and connections throughout the county system. And every team I've seen is always stronger at the end of the week, and so it's usually a really great time.
That's great. That was a great answer. I'm going to kill those kids.
I know.
Just as you're giving those answers, these kids are like jumping around. Was that going to be okay?
No, that was good. And I tell you. Yeah.
Oh, yes. So how has it affected patients? What's the positive impact?
I would say.
Hang on. Sorry. And rolling.
I would say overall, making a system smarter and more efficient, and making things more, a patient's time, treating it as very valuable is probably the biggest benefit. And one example is that we watch, how long it takes for a patient to be seen in the clinic, and we track the times and we're able to see. And our goal with all of these LEAP systems is to provide excellent care, but more efficient. And so we're really trying to reduce the time that it takes for a patient to be seen in the clinic. And we're noticing that with all these efficiencies, it's getting shorter and shorter. And I think that's really important.
Okay, can we cut and do that one again? There was so much noise. There were plants coming from all over the place.
I can't believe how noisy this place is.
Yeah, when you record, you never know till you put on a mic.
Sorry, Rocky.
Do that again. That was good though.
Yeah,
okay,
and you don't need me to. I don't need to ask the question again because I'm not. You're never going to hear me. We're going to cut.
Okay. Oh, okay. Okay. Damn. Okay. So what is it? It's like, what do I see?
So what's the benefit? Like, how has it benefited the patients? Why is using LEAP? how does it make the world better for the patient?
For the patient. So
Yeah.
using LEAP principles, I think when you look at it in terms of the patient, our whole goal is to provide value-added services for the patient. So our system getting more efficient, giving faster, better, more effective care is all for the patient. And one example of that is we really look at how do we make our visit, a clinic visit for a patient, faster? How do we make it so that they're not waiting an hour in the waiting area and then 20 minutes, they only get 20 minutes with the provider and then they have to wait another hour in the pharmacy. And we're trying to really streamline that process. And so all of these LEAP principles put together is really going to make the clinic visit more efficient. And that's what we're striving for.
That's good.
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 Okay, thanks.
Two. Action.
So if you could just tell me your name and title and what you're responsible for in the health system, please.
Jean Fraser, Chief of the Health System. I'm actually responsible for the whole health system.
Okay, so what, in that area of responsibility, I mean, is it the success of the whole health system, and you kind of have your eye on all the different departments? How does that work?
The health system has 9 operating divisions and 2 support divisions, so we are a very large and very complicated system, ranging all the way from prevention services in terms of traditional public health services, making sure our food and our water are safe, watching out for contagious diseases, all the way through mental health services and certainly medical services at the San Mateo Medical Center, and pretty much everything in between. So in my role as the chief of the health system, I set the overall strategic direction for the health system and then work with the division directors to make the tactical choices that'll help us achieve our mission. Mission's very straightforward. We work to help San Mateo County residents live longer and better lives.
Great, thank you.
Adrienne, I'm moving my chair. I just realized I'm probably distracting.
No, not at all, don't worry.
Sorry.
So, okay, great. So the next question I have for you is, if somebody came up to you and said, "What is this thing lean? What does that mean? Could you tell me about it? What would you say?"
Lean, or as we call it here in the sorry, yeah, that's what I was going to say. So LEAP, which is our name for lean, is a wonderful process that's really deeply rooted in the conviction that the people who know how to solve problems are the people who experience them every day. So it's really our line staff. What LEAP is a system by which we identify those problems and then ask the line staff, often with input of our patients or our clients or our customers, to come up with solutions to those problems. But it's all done in a very structured way so that we make real progress on those solutions that people can see, first test before we actually implement, but then can implement to see real results in our outcomes.
Very good, thank you.
So I have to tell you, I'm used to doing interviews, so I have like a 30-second clock running in my head. If you want longer, I can do longer, but I'm used to like stop. Yes, exact.
These are great for editing.
That's what I figured.
Life a lot easier.
That's what I
No,
figured.
that's really good.
Could you tell me a little bit about, this is something I've been trying to kind of get to, is the measurement piece. That, I know that people come up with these, you go into these groups and the ideas are put together and procedures and things like that, but how does it get measured so that you know that you're doing the right thing?
Yeah. The LEAP process is profoundly based in measuring, because honestly, if you don't measure what you're doing, how do you know whether you're getting better or in fact maybe we're actually getting worse? So the beautiful thing about LEAP is that it doesn't create thousands of measures. It asks the people who are involved in whatever the work is, what are the important measures? And usually we use 3, maximum of 5. And we pick measures that specifically look at what are the particular outcomes that we want to reach.
Okay, and what happens, if you talk about what happens if you are getting great results, like what's the next step, and what if you're not getting great results?
The reason we really like LEAP is because it's very much a plan, do, check, and then act. So using measures is really the way we make sure that we're actually making progress. For example, in a Kaizen week, we'll start off with some target measures, and we identify how much progress we want to make, but during the course of the week, we actually test what we're doing against those measures. Are we moving them or not? And if we're not, we go back and change the work so that we actually make the progress that we want to see.
Very good, thank you. Okay, so let's see. So I guess the next thing I would like you to talk about is spreading. So I know that that LEAP really started with the medical center. I believe that Susan was really spearheaded that, if I'm not mistaken, and she was very passionate about that. She was working with that in the health center, and then it ended up, well, it got spread into the health system. Like, it was bought by the health system, and I don't mean bought, like adapted, or, you know, but could you talk about that, like why the health system decided to make a commitment to LEAP and how it's kind of becoming the way that you do things?
We were extraordinarily fortunate here in the health system to have champions for LEAP in the medical center. I've actually had exposure to Lean in my prior position as the CEO of the San Francisco Health Plan. If there's one thing I've learned about it, people really have to believe in it. You need to have champions, as is true for any change, before it can really make a difference. So we were really fortunate that Dr. Susan Ehrlich and Dr. C.J. Konopoli learned about LEAP, called Lean in the outside world, primarily through the California Healthcare Foundation. They were giving grants to expose public systems to the Lean philosophy and methodology. Once Dr. Ehrlich and Dr. Konopoli understood the power of LEAP to really transform organizations, they embraced it within the medical center. It was really the proof being in the pudding. Seeing the results that they were able to accomplish within the medical center made it not just an easy sell. Actually, other divisions wanted to have LEAP spread to them because every division has problems that they want to solve. The LEAP methodology is used in so many different industries, not just in healthcare. In fact, it was pioneered in manufacturing. So it's absolutely applicable and has already produced great results in our behavioral health division, in our aging and adult division, and literally as we speak right now, we're working on it in our public health and policy division.
Okay, great. Now, can you talk? You ready?
Yep.
Okay, so again, if you could talk about some of the early successes that you saw that really got the system excited, and then some of the more recent ones that you're seeing now.
One of the great things about the way Dr. Ehrlich and the medical center started using LEAP is that they immediately used it to tackle some of our hardest and most visible problems. So perhaps one of the ones that sticks the most in my mind is that when I would come to lunch, which I do most days in the medical center, I would pass this long line waiting at the pharmacy. And each time I passed, I felt badly for the patients who were having to wait such a long time and for the staff who had the pressure of all of these folks sitting and waiting, knowing that they were needed to get the work done and that they were, in some cases, disappointing customers and patients. So the medical center really attacked the issue of the waiting time for the pharmacy, and the proof really is in the pudding. Now when I walk over to the cafeteria, the lines are short, people are happier, it's not nearly as chaotic. That's the kind of success that obviously breeds the desire to spread it throughout the whole system.
Great story. So how about some things that you've seen since then?
One of the great things about LEAP is how applicable it is to really any kind of process. So while we've had great early successes in the medical center, we've had extraordinary successes in other divisions as well. Perhaps one of the ones that is most meaningful to me is the reduction in how long it takes us to get someone into the home of an elderly or disabled person who really needs that help to stay out of the hospital or out of a skilled nursing home. Until we started LEAP, we didn't understand that the waiting list, or not the waiting list, but the waiting time was over 120 days. When you think of what could happen to people during that time, it was really demoralizing that we had not tackled this problem earlier. Through just the work of the Kaizens, we were able to radically reduce how long it takes us to get a provider in there. I believe we're now down below 30 days, and our aim is to get even faster. So those are the kinds of results that speak for themselves. That's exactly what we want to do, provide the best service we can in the fastest way possible to those who are most in need.
Okay. Can you talk a little bit about, we've been talking a lot throughout the videos about the effects that some of these problems had on the patients and then the benefits to the patients. And I'm definitely getting a feel for, how it's affecting staff, for example. What about the community as a whole? How does it benefit? A lot of people, like for example, I know that the Affordable Health Care Act is, there was this need, and then because of a change in regulations and laws, the Affordable Health Care Act did require that a lot of these times be shortened, which meant that it had to be done now, right? I mean, things that you wanted to do anyway now became really critical. And there's a lot of criticism about the Affordable Health Care Act, but I don't think a lot of people really understand that it's actually improving the lives of people who are having shorter wait times, for example, who are being seen and getting home health care workers, home care workers in their home. And it's actually reducing probably the amount of suffering, and it's also saving money for the taxpayer. It will, overall. So I don't know if you could talk about that a little bit, kind of the bigger picture of how this meets the greater needs of the community.
One of the great challenges and opportunities we had in the last year was the expansion of coverage both under Medi-Cal and private insurance through the Affordable Care Act. And yet as we contemplated that as the health system, at the very same time that we were anticipating many more people coming to us for services, at that time we had a long waiting list for primary care appointments in the medical center. So we really faced what I would call almost a cliff. We knew we needed to meet a new demand from the community, and at the same time we weren't even meeting the demand that we had at the time. So by applying LEAP to our wait list, we were able to bring that wait list rapidly down to, actually as of today, it's down to 0, and at the same time be able to absorb additional new patients who got coverage through the Affordable Care Act. So to me, that's an example of how LEAP obviously helps us, it helps our patients, but it also helps the broader community.
So do you guys have anything that you...
So with aging an adult, it was, I think it's 60 days?
I couldn't remember, I made it up.
Yeah,
Do you want me to?
Our goal is 30, so that's
Yeah.
why you remember that.
Yeah.
But I don't know if you want to...
Do you want to do you want to say 60 days? I mean, is that a good thing?
Well,
It's just factually inaccurate. I just gave a factual inaccuracy.
I think the reason why Adrian's asking is there was a concern whether we want to actually be admitting that
It's still 60,
there's
that it's not,
regulatory.
if it was 30, it would be wow. but 60
Yeah,
is
no,
still
there's
cool.
not a regulatory requirement.
we're fine.
So
Yeah.
that's a positive that it's down to 60,
Mhm.
that it was,
Mhm.
okay, so do you want to maybe make a statement about that? Like
Yeah.
it was 120 and now it's down to 60?
So why don't you just start with aging and
our
adult
goal is-
services?
Yeah,
Because
yeah.
we can, we
No,
can
I
fix
can
that.
edit, yeah.
Yeah.
So Aging and Adult Services used LEAP to tackle one of its hardest problems. Using LEAP, we looked at the question of how long does it take for us to get a provider, someone to assist an elderly or disabled person to remain in their home, staying out of the hospital and out of a nursing home. When we first started, the length of time was 120 days, much longer than any of us obviously were comfortable with. What I'm really pleased to report is that through the work of LEAP and of course the work of the staff in Aging and Adult who've been involved in it, we've been able to bring that waiting list down to 60 days with an ultimate goal of just 30 days.
Great. It's good.
Right.
Waiting time.
She's great.
Yeah.
She's awesome, but I don't know if that's a significant enough thing if you think we should.
I thought that was
It's good.
I thought it makes sense.
Yeah. Yeah.
And that also speaks to the continuous improvement part of it.
About the leadership system.
Yeah, that's what I was going to talk about.
Whenever you're ready.
So from my perspective, the next step we need to take in our LEAP evolution is really developing a performance system, a management system that can support all of the improvement work that we're doing. While the Kaizen events are important and give us big leaps forward, we really see problems occurring every day, and we need to use the LEAP principle of mistake proofing at the source, making sure that we don't make errors that harm our patients or cause problems later on. We really need to develop all of our staff members into problem solvers. I've been incredibly motivated, impressed, inspired by a visit to a healthcare system that's more advanced than we are, has been using LEAP for a longer period. It's really extraordinary to see how their staff identify and resolve problems almost immediately. They're really empowered to make decisions and to take action in a way that we haven't learned how to empower our staff. So I'm really excited that we're embarking on the next stage of our journey. It's going to be hard. It's going to require me to manage differently. It's going to require many of us to make changes, similar to the way we sometimes ask our line staff to make those changes. But if there's one thing I know this management team is committed to, it's the idea that we're never done, that we have to get better, that that's what our mission is all about. And I'm really excited to be working with everyone and making this a great place for all of our patients and clients.
Okay,
That was awesome.
wonderful. Yeah, no, that's
That's
good.
good.
That's a good message to everybody. So,
Running on 2 cameras in action.
So the next step we're going to take in our LEAP evolution is to develop a management system, really a way of supporting all of our line staff in identifying problems at their source and solving them at their source. We've had extraordinary results from our Kaizens. We're getting better at sustaining those results, but we need to have a way to make sure that we can have those kinds of results every day and not drift away from the great progress that we've made. At the same time, we really need to align the work that's being done by line staff all the way up to our managers, to our executives, and ultimately even to me. I've been extraordinarily impressed and really honestly inspired by what I've seen at other healthcare systems that are further along in their LEAP journey than we are. The way their staff are empowered to make decisions, to take care of their patients, to eliminate barriers to great care, and to make sure that their patients are safe is really extraordinary. So the next step we're taking is to learn from those great organizations and then do it here. But it's going to require change. It's going to require change in the way we manage. It's even going to require change in executives and even in my daily work. I'm going to have daily standard work, just like all of our line staff. So it's a continuous learning process. But what I love is that I'm working with a team of people who are totally committed to the idea that perfection is something we need to constantly strive for. We'll never reach it, but there's always a way that we can get better.
actually, that was nice. I like that,
Yeah.
that version better.
Okay.
And I was hoping, I
Really
didn't want
good.
to complicate it, but I was hoping that the standard work, leader standard work
Yeah.
idea came, which is.
What your responsibilities are in the system or at the medical center. And then I think I'll just start going right into the questions about, you know, what was happening at the organization that led you to the decision to make change. And you can talk maybe a little bit about the earlier days and how that kind of happened.
Okay, sure.
All right, you ready?
No, hang on. There's another little focus check.
And then anything that I haven't thought of, I mean, if you want to add stuff. You've
Okay.
done a million video interviews before, I'm sure, right? So you know. when
Maybe
you can
not quite a
stop,
million, but
But 500,000. And then we can stop at any time, and
okay.
my voice isn't going to be in it.
Oh, okay.
Yeah, so if I say something stupid, it
We're
doesn't.
rolling on 1, rolling on
So-
2, and action.
Okay, so if you could just tell me your name and title and what you do for the organization.
I'm Susan Ehrlich. I'm the CEO at the Medical Center. I'm also a primary care doctor, and I take care of seniors. And I do both of those things for the organization.
Wow, I'm just on a personal note, I didn't realize you were still seeing patients
I do.
and running the medical center at the same time. That's pretty impressive, so. So when you say that you are responsible, did you say you were the CEO of the medical center?
I'm the CEO of the Medical Center.
So just very briefly, like what does that mean to somebody that might not understand what your, kind of some of your key areas of responsibility are?
Right, so San Mateo Medical Center is really an integrated delivery system, and what that means is that we have a full range of services. Mostly, we actually provide ambulatory services, and that means primary care patients, primary care services to patients. We take care of about 75,000 people a year, and most of them come in through our clinics, so about 40,000 kids, adults, and seniors that we see every year. We also run a hospital. We have an emergency department, and as part of the hospital, we have psychiatry, we have inpatient medical surgical services, we have a skilled nursing facility. We also have an operating room, and then we have same-day surgery. So we have a whole bunch of services so that we can provide a complete delivery system for our patients.
Okay, thank you. So in getting into the whole story of LEAP, what can you tell me about what was happening at San Mateo Medical Center when you realized, you and the others realized that the change was needed, and when you started really looking at how to do that? What was going on? What were some of the problems you were having?
One of the things that I really love about being at San Mateo Medical Center, and I've always loved this, is that we have an incredibly creative, energetic group of staff, providers, line staff, all types of folks who are here to take care of our patients in the best way that they can. And in the early years when I was here, I've been here for 11 and a half years, we had a philosophy that was really about letting every person take their idea and run with it. And so we did a lot of different things about around improving the medical center. And it was really up to individuals to decide what those improvement efforts were, where they got their ideas, where they went with them. And that was fine for a while. But then in 2010, we realized that the Affordable Care Act was coming our way. It was going to be implemented in its fullest way on January 1st of 2014, and we realized that there were many, many things that we needed to do to get ready for that. One of the major things that the Affordable Care Act did was to cover many more people with insurance who had never been covered before, and that was an incredibly wonderful thing for our patients. But at the same time, it required that we needed to be a provider of choice, that we couldn't just be the safety net place where everybody came because they had no choice. There were many, many ways that we needed to improve. We needed to improve the quality of care we provided. We needed to improve the experience for patients. We needed to improve the way our staff was engaged in what we did. And we needed to reduce the cost of care. And you can't do all those things at one time when everybody is running in a different direction, thinking about how to improve the medical center. So that was the beginning of the thinking about why we needed a consistent philosophy and set of tools for improvement. In 2009, we had the opportunity to experiment with Lean. We had a grant from the California Healthcare Foundation, and we did a couple of improvement events. The first one was around congestive heart failure. And I remember really clearly the first report out we had from that very first improvement effort. And I was totally blown away by what that team was able to accomplish. Because really what happened was, for the first time, we brought together a group of staff and providers from all over the delivery system to focus on one problem, how we treated congestive heart failure at the medical center. And those folks had a week to really focus on not just the problem, but all the ways they could improve it. And when I watched what that diverse group of staff and providers was able to do in a week, it was truly impressive. And I think the thing that I've loved about Lean and now LEAP as we have it in the health system is that I've never been not blown away by those report outs. We've had about 70 events, week-long events at the health system over the past 3 years. And every single time, it's always amazing what that group is able to accomplish.
That was really great. I have no idea if I can edit 1 second out of what you just said. That's like the whole video right there. Okay, that was so good. Okay. So let's see, you talked about that, and we talked about that. This is going to be so seen by other people that work here, people that haven't been involved with Lean yet, and we want them to be excited about it. Maybe you could talk a little bit about the way things were for, maybe on a frustration level for some people that you, I don't know if if you feel that Lean has really boosted morale, if you feel like a lot of people that work here are feeling more hopeful in their jobs, like maybe you can address that issue a little bit.
Sure. I think that one of the things that appeals to me and many of the people who are devoted to LEAP at the health system is that there are two things that are core to the philosophy. And one is the focus on the patient. We always have the needs of the patient first when we do improvement at any time, at any place in the medical center. And the second thing is that it's about respect for staff. And the way we incorporate those things into the tools and philosophy is that when we do improvement events, we're always asking ourselves, what is it in what we do that the patient would be willing to pay for? And we don't literally ask patients to pay for what we do, but we think about it in that way. And we actually even bring patients into these processes. So having patients involved and hearing the patient voice is incredibly powerful. And I think that's especially meaningful here at the medical center because we know that because we are a safety net provider, people come here and work here because they care about the patients we serve and they care about the community we serve. And so that part of it is very meaningful to people. The second thing about involving staff and engaging staff and respecting staff is also important because in any healthcare system, in I think any working environment, people feel disengaged because they feel like they have no control over what happens. They feel like they aren't asked about important decisions or even non-important decisions that are made. And that's one of the great things about the LEAP process is that it goes to the line staff and asks them, what do you think the problems are here? What are your ideas for improving them? And it incorporates those ideas into standard work, and then we take that standard work and we implement it in the workplace, and then we spread it. And we continue to look at it and test it over time. So we're asking the patients, we're asking the staff. So at its core, the philosophy really addresses the things that are most important to the people who work here.
Great. Okay. One thing I would like you to talk about is, what is Lean? We talk about here that why did Toyota create it? What is it?
Right. So the Lean philosophy started with the Toyota Motor Company back around the time of World War II. And at that time, the United States was absolutely dominant in the auto industry. And Japan was just coming out of World War II. Its population and its economy were completely decimated. And they were trying to figure out, how can we compete with the US auto industry? And if you think about the disparity between the Japanese motor industry and the United States motor industry at the time, I'm sure it was laughable to think that they could compete. And so they started realizing that they really needed to examine their processes and the way they did things in a very, very careful way, because they couldn't afford to have any waste. They couldn't afford to have any problems with quality. And so that was the beginning of looking at processes. And it's only been recently that Lean has been used in the health industry. But if you think about it, we have so many processes and there's so much waste in what we do. And it's so wrong for our patients and it's so wrong for the staff who are stuck in processes that are so wasteful. And so it's just been a great boon for us at the medical center and in other places that use the tools and the philosophy.
So when you say waste, could you talk about that a little bit? What does that mean? What kind? Because Jean had sort of shied away from that word a little, and I want to make sure that people don't feel like, oh, they're going to lose their jobs, and I know that that's been a concern. So.
Right. Right. I think it's really important when we talk about waste. We're not talking about individual workers who are deliberately causing waste. What we're talking about is systems that we create as an organization that are wasteful. So for example, we have systems where we require people to do things over and over and over again. Or we have a computer system that gets checked manually by a person that gets manually checked by another person that goes into another computer system. It's things like that, it's processes like that that are wasteful. I remember one event that we did that was focused on adult vaccination at our Daly City Clinic, and we realized that nurses who were administering vaccinations were walking miles every day that they didn't need to walk. And by implementing the improvements that we made, we cut miles and miles of walking out of a nurse's day. So why is that important? Because all those miles that the nurse spends walking, she could be spent giving more patients vaccinations. So the waste is really not waste that individuals are creating, it's waste that systems create that are really have no value at all for the patients.
Great answer. I think you've answered a lot of this. So my next question to you is, why did the San Mateo County Health System change the name to LEAP? What is that about? Instead of, why not just call it LEAN?
Right. So there are some things about lean that alienate people. There is a lot of complicated terminology. There are a lot of Japanese words that mean specific things that are important, but sometimes that creates a barrier between the philosophy and the important things about it and the people who are trying to understand it. I think what we wanted to do when we created the health system brand of LEAP was to really own the tools and the philosophy for ourselves. And so LEAP is an acronym. It stands for Learn, Educate, Aspire, Perfect. And those, did I say it wrong?
Yeah, learn, engage.
Learn, engage, sorry.
It's okay.
It's educate too.
You can just.
I'll say it again.
Yeah, LEAN is an acronym.
Yeah. So LEAP is an acronym. It stands for 4 verbs that we as a group felt really captured the essence of the philosophy for us. And so L is learn, E is engage, A is aspire, and P is perfect. And those are the things that we do. And what I've seen with the name LEAP and the brand LEAP, it helps people understand that this is really our own thing. And we have taken lean and we've changed it in ways that make it more meaningful and useful for us.
Okay. Now is that something you think we should talk about at all? Like those specific things, or you know, is there something that you'd want to mention?
I think it's
in
important.
particular?
I think it's important to talk about what the acronym is and the fact that it, you know, what it means, and that we're using it to engage folks. I mean, don't you think?
Yeah.
Yeah.
I don't know that you need to get into. I think it'll be too deep to
Okay,
go into
yeah.
each of those. Yeah.
Okay.
Right?
So perhaps you could just talk about the most important beneficiaries of LEAP, and maybe citing an example of something that had great results to it.
Ultimately, the people who benefit most from LEAP are our patients. And I would say closely followed is our staff, because they aren't as frustrated by having wasteful and just non-value-added processes at the medical center. I think one of my favorite examples of the gains that we've been able to make is the work that we did in our new patient access value stream. And one of the reasons it's my favorite is because it's so easy to understand how valuable these gains were for us. We started the work with about 2,500 patients waiting for new patient appointments. And we tried to really understand the process. We went through a series of Kaizen events, which are improvement events. And by the end of 18 months, we had 0 patients on the waiting list. And there was nothing else that happened other than the work that we had done through the LEAP process that explained that change. We didn't have fewer patients coming to us. We didn't change our processes in any other way. And so it was really all about the very dedicated work that each of the improvement teams did, as well as the staff and providers on the ground who implemented the standard work to make that happen. That's 2,500 people who are getting primary care, and now every day that we don't have a waiting list, it's that many more people who don't have to wait for care.
That's great. Let's see.
So it's kind of like the framing is at the next point in our evolution,
Mhm.
or
Yeah, we didn't cover that.
One of the things we've tried really hard to do is to continue to envision the future for LEAP. And we've done this work now for 3 years, and we're very clear that there are some extraordinary gains that we've made, but there are also many ways that we can continue to improve what we're doing. And one of the most important ways is that we, the leaders of the organization, need to have standard work and standard ways of approaching the work that we do. Because what is happening now in our organization is that most of the improvement is confined to the week-long events that we do. And those are great. We pull these teams together and we have this very energetic work and high-quality work that's done to get to improvement. But then the work has to be improved by the staff on the ground. And what we've seen is that in some cases that improvement work continues, and in some cases it doesn't. And what we've concluded is that we really need to have consistent leadership on the ground, leadership meaning supervisors, managers, and executives. All of us need to be doing work to support the line staff. And that's really the next phase of work that we're going to be engaged in, just to make sure that we move from the paradigm of event-based improvement to continuous daily improvement. And that's what we as leaders need to do to support the line staff and to really make sure that the gains are as great as they can be every day. Is that what you had in mind? Good.
You know, I thought one thing just before we're done, I think it's really interesting that one of the employees that we interviewed today, she said how when you go into an be the CEO, but then to be able to be really close to the people that are doing the work and to take off your CEO hat, you know, kind of dig in and solve problems as part of the team.
Right. One of the really interesting philosophical tenets of Lean is this idea of servant leadership, but also servant leadership involving humble inquiry. And what that is about, in my mind, is that I, for example, take off my hat as CEO and just imagine myself in the shoes of our staff and really try to stop and look and listen and understand exactly what's going on. And that happens during the weeks of these improvement events. You literally stand and even for hours watch what staff do as a way of really, really understanding what it is they're facing. And so this idea of all of us being equal and leaving your title at the door is really an important part of the process and one of the things that appeals to me about it. It's very similar to what's happening with primary care as a whole, I would say, because there we're really trying to approach patient care as a team, and that all members of the team are equally important. The doctor, the nurse, the social worker, the administrative person, we're all really important, and we need to use our skills to the largest extent to help the patient.
Great.
Can you
Okay.
do you have some more time?
Yeah, how are we doing with batteries and all that?
Well, we're good.
I was just gonna, I mean, I think what you talked about, experiencing improvement from that standpoint, I think the walk in their shoes idea and just empathy of both as a person, for you as a CEO, what is the role of empathy in designing processes and doing improvement work?
Well, that was interesting too about the patient, because you do bring the patient. What you were just saying, that's one thing you didn't mention when you're talking about being in an event like that, that when you invite a patient in, you really can get into step into the shoes of the patient as well.
Right.
And
Which
there's
is
a
a little
connection,
different.
yeah, that's right, and there's also a connection to, you know, supporting staff and bringing that side of themselves. You know, Jean talked about this idea of like, and I think you referred to it too, why do we enter into the fields that we do, and especially serving the safety net? So how is it that we can support people in really bringing that side of themselves to the work? Or does
Okay.
Leap do that?
It's a tough,
Okay.
it's a couple different things.
Right. Okay. Are we ready?
We're rolling.
Okay. One of the things about the improvement events that I've also really enjoyed, and that's fundamental to the work, is the involvement of patients. And as I mentioned before, most people work at San Mateo Medical Center because they care about serving the community and care about the patients. But the problem is sometimes the work that we do is so difficult and we're barraged by so many things that we just forget that. And it's great in this work to be able to really not only step into the shoes of the staff who are doing the work, but step into the shoes of the patient. So for example, we had an event that was focused on patient experience in the psychiatric emergency room. And we brought patients in who had been in our psychiatric emergency room during these periods of unbelievable crisis and talked to us about what their experience was like during that time. And it was incredibly meaningful because they were able to tell us that their lives had been saved by the work that we had done, but that sometimes along the way, we really hadn't treated them like human beings, and that we had looked right through them, that we hadn't looked at them in the eye, that we hadn't told them that we cared about what was going on with them. And those moments were really meaningful. And so when we realize that, we can get back in touch with what had us involved in the work to begin with. And we can actually create standard work that allows us to have time for empathy.
Wow. It was perfect, and Nancy is the patient.
Yeah,
Who
that's
is
going to be great. 'Cause
In the overview video, wasn't
Yeah.
she part of that?
Mhm.
We just doing it anonymous.
That's up to you. If you want to.
Oh, I don't mind. No, everybody knows me. That's okay.
Then we'll probably use your first and last, but that's okay.
So my name's Nancy Wilson, and about 6 years ago, I came to this hospital for treatment in the psychiatric ward.
Okay. And, well, that would be a good place to start. I mean, are you comfortable talking about why you came here and what are you comfortable talking about and anything?
I'm talking anything.
Yeah. Okay, so if you just want to tell me a little bit about that, like why you came, what your experience was, that'd be great.
Well, I came on a 5150, so this was not a voluntary admission. So of course I didn't want to stay here. I was diagnosed with major depression, post-traumatic stress disorder. I'm in recovery now. I was an addict and alcoholic. I was malnutritioned, and they kept me here on the hospital for the 72-hour hold, and they extended it. So I ended up staying for almost 2 months. So that's why I was brought here. Yeah.
And, okay, well, so it sounds like you have a really interesting story, and so then later they approached you and told you about the LEAP program that they have, right? And they wanted you to participate because they were interested in your feedback and everything. So if you could tell me, I guess, why do you think you were asked or why to participate in LEAP? Why do you think they picked you?
I'd like to say because I'm special, and which I am. Well, let's see, since it was over 6 years ago that I was first here in the hospital, a lot of the hospital staff started noticing me do things in the community, that I was in recovery, and that I was active on commissions and doing things within the hospital system and behavioral health. So I was approached to participate in part of this LEAN project, Did you want me to say lean or leap?
Whatever you're comfortable saying.
Okay, because I know it just changed.
Leap is better.
Leap?
Yeah.
Okay, okay. Then they asked me to participate in the leap, and I felt excited. I felt like they're making changes, and the changes that were necessary, and I felt they asked me because who better to ask than somebody who went through the system?
That's true. Okay.
Mhm.
Well, what were some of the things that, as a patient, that you noticed that you thought weren't working right, that you were later to, that you were able to kind of give them feedback on in the LEAP, you know, the workshop? Right? So what were you able to draw on? Like what kinds of things did you share with them?
Environment, how the environment wasn't welcoming. It didn't feel safe like it was supposed to be. This was supposed to be a safe place in a locked facility. And the fact that the choices were taken away from you when you're in a locked facility, right? It's not like you could just walk out the door. But I think they tended to forget that we still have choices, as simple as they may be, like what kind of Jell-O do you want to eat? Do you want to take a shower now or later? It was more of a, this is the way we do it, and we're going to do this with everybody, even forgetting that you're an individual. So I think what I brought to the LEAP week long that we were in was just a lot of humanness again. We are a system. This is a system, and these are some of the guidelines that we work with, but we tend to forget who the person is. So I think I brought that human touch to it, from the aspect of I'm not a colleague of yours, but I was a patient here.
That makes sense. After you answer, I'm just going to pause a little bit.
Sure.
So if you wonder, why isn't she saying anything? 'Cause
That's okay.
It's just good to have a little extra footage at the end of your, what
Okay.
you're talking about.
Okay.
So that's really interesting. So what was it like when you were in the event? Like, what kinds of things did you do in the conference room, and did you do anything outside of the conference room? And like, were you there? I don't want to ask you like a million questions at once.
That's okay.
But like, were you there for the whole week? And
Yes.
how like involved were you? What did you do in there?
Oh, I was there for the whole week, and it was 7-hour days. We had a lunch break in between. We did everything. I mean, from start to finish. Like when they first arrive in the unit, you know, how are they greeted? How welcoming is it? Are we pushed to ask them too many questions all at once? They're just here, and you know, it's traumatizing for them, for us clients that come to the unit. So we went through the whole daily process that a nurse or a doctor or even the nurse's aides go through. And how can we define or tweak how things are done to make somebody feel a little more comfortable. So I was involved in the whole aspect of, as far as like, when do they get referred out? Who does the referral? Do we let the doctors take care of that? Or would they feel more comfortable with a nurse aide doing it rather than somebody in authority? So we talked about all that. Everybody was brainstorming. It's just like, well, you know, I really would have felt better if the nurse's aide would have talked to me about things, because I was already afraid of the doctor because he's the one that kept me there for another 3 weeks. So I really didn't want to listen to anything he had to say. I would have been a little more receptive if it was somebody that I felt comfortable talking to. So, you know, just those types of things. You know, we stayed a little bit out of the supply room stuff. That was a whole other project. So this was just about how people come in from PES up to the unit.
So do you know if any of the things that happened, you know, in those workshops,
Mm-hmm.
that, you know, in terms of what came out of it, do you know if they've made changes?
Oh,
since
yes.
then? Like, what do you know? Could you tell me about what's been changed?
Well, to the fine detail, let's see, they've painted some of the walls in PES. I always want to say 3AB and it's PES. And made it a little more welcoming there. They've changed the way they greet people up in the unit, giving them time to settle in. And I do know that's changed because I go up there now and I see clients that I serve that are in the unit. And I'll tell you this one thing. I was up here 2 months ago, and I walked by, I was going to 3AB, and out in the little lobby area is where they keep all the reports that they do on the LEAP project. Because they have to keep a bulletin, a running bulletin about things that are getting done. They were having a little powwow right there talking about everything that they still needed to do, and I'm like, right on. I even told Liz, I said, Liz Evans, I said, Liz, that's great. I said, I see you guys are still doing this. That's wonderful. She's not giving up. You know, it's going to take some time to change how things are run and get everybody on board, but she's still doing it. She goes, yeah, we meet out here every week. And I was like, right on. She goes, you want to come back? And I'm like, no, I got to go to work. But I would come back and do some more. As a matter of fact, I've done 3.
Okay, so now I'm really intrigued. So you said that you see some of your clients.
What do I do for a living? I'm a case manager. Yeah.
Are you a case manager with the system?
With the county contract, yes. Mm-hmm.
Is that something that happened as a result of your work with LEAP, or were you doing that before? Or?
Actually, I had a seat on the Commission for Mental Health and Substance Abuse for 3 years, and I just became involved with community service as a volunteer and as part of my position on the commission. Position on the commission, that kind of rhymed. And then I thought it was time to pursue a career. So here I am.
That's great. So did your position on the commission start before or after? So you came to the hospital as a patient.
7 years ago. 7 years. It
was after that that you got the position on the commission.
Right.
And then after that, you were invited to do the LEAP workshop.
I was still on the commission when I was doing the LEAP. The second one. Yeah, I was still on the commission.
And then at what point did you start become a caseworker?
2 years ago.
So that was after the LEAP.
Mm-hmm. Mm-hmm.
Okay, so did the LEAP event, do you think that was part of, or I guess I would say, how did that contribute to your journey to your new profession, right? I mean, it seems like a lot of things have led you to that point in your
yes.
life, right?
Mm-hmm.
So maybe you could talk about that a little bit and just how being involved with LEAP was part of that.
Just having a better understanding how the whole system works, not just from paperwork to referrals to who the best contact person is, just making those connections with all the players that were in the room during all these LEAP trainings. Was that not right to say?
No, I'm not supposed to make any sounds. Sometimes I go,
oh.
I'm not supposed to do that.
Oh, okay.
Because then my voice won't be on here. So that's why I'm not really saying anything while you're
So
answering.
we won't hear the questions, we just hear the
you won't
answers.
hear the questions, so I'm trying to be really quiet while you're talking,
Oh.
but sometimes
She's
I
not
want to
meant to
go,
react.
really?
Okay.
And I can't,
Yeah.
you know, sometimes I forget.
So where should I leave off? Where should I start over again?
Where did we?
I don't think that would pick up though, because
You
it's so
don't?
close by.
Okay.
Okay.
That was
Yeah,
good.
we were just
That was
talking about
good.
your journey and.
Oh, okay. So being part of that process 3 different times, I was able to come in contact with a lot of different, for lack of a better word, players. Everybody that's in the mental health system as well as the public health system, the hospital. So I was able to figure out, you know, what resources are available, you know, who the best referrals are, you know, where to contact all these people. So yeah, it did help with my job a lot. And not only that, but seeing my clients when they do come here, being up on the 3rd floor and knowing everybody up there. It makes it a little easier to talk with the doctors when needed, and it just feels more comfortable. And in return, my clients feel comfortable. They're like, wow, okay, you know what you're doing here. So it's not like I'm fumbling around trying to figure out what's going on next. I already know. So yeah, I would contribute that to being part of the LEAN project.
And then plus your own experience as a patient, I would imagine that makes you a lot more empathetic to your
Oh yes.
clients. There's so much noise. It's been.
Are you part of the hospital system too?
No. I Yeah, so I have a contract and I do different marketing things. And in fact, we designed the LEAP logo. I don't know if you saw it, the new logo for LEAP. And I've been working with the hospital for probably 3 floors. I didn't think that would happen. You know, I don't really know that I have anything else. I mean, do you have anything that you think I should ask her?
You know what? I think you've done awesome. I was thinking the question you've been asking people, she's been asking staff
Oh,
some
yeah.
questions too. And one of the things you asked her going,
So, if you were to describe or like explain what LEAP is to somebody that didn't know anything about it, how would you describe it?
An unforgettable experience.
Could you say LEAP? Let's wait till.
Yeah, if you preface it with LEAP.
Yeah,
Okay,
if you say
okay,
LEAP,
okay, got it. Sure, sure, sure.
Yeah, you go. I'm just looking for it.
No, they went upstairs.
Everybody's getting off work.
Hello.
It's like the worst time.
We're wrong.
You could just say LEAP. LEAP is an unforgettable experience. So you say LEAP is, because that's what you said.
Yes,
right?
yes, but,
Okay.
okay.
And then go on.
Then go on, okay. So ask me the question again so I get back in that mind frame, please.
So, if you were to explain, should I wait?
No, it's not
It's
crazy.
just not really.
No, let's go.
Okay, good. Okay, so if you were to describe LEAP to somebody who knew nothing about it, somebody that was going to participate in an event, how would you describe it? What would you tell them it is?
I would describe LEAP as an unforgettable experience. It was the most, there was a bunch of feelings in there, but just to see a head of a department want to change things so dramatically and have that much dedication and compassion for all the staff that were involved in part of this and the ones that they had to roll this whole out to. They were very flexible, willing to make changes for the better. It was great. I mean, I got to meet the CEO of the hospital, and she really, it was very impressive, very impressive. She actually asked me to come and speak at one of their management meetings as well. So just to be in a room where typically we think people have a lot of ego and it's going to be my way or no way, it was a very collaborative effort. And nobody's ideas were left out. I mean, if they were put on the side table, they were talked about later. So everybody had an opportunity to contribute something. And how much you wanted to participate was up to you. But I participated in all of it because I just like to be heard, I guess. And I felt like everybody didn't walk away thinking, oh, nobody took my ideas, because it was all about collaborating with each other. How can we make this work?
So if you were to, I don't know, so if you were to actually define it, like, what is it? Is it a process? Is it a way for people to solve problems? Like, how would you explain what it is? Like, and then that'll be my last question.
I would describe LEAP as a transformation tool. It's a process that you go through to transform a system. And it's not about money, it's about transforming a system that works for everybody, not just for the staff, but for the people that walk in the door. And having everybody involved in that, it's like your whole family is uniting, it's coming together. And yeah, I would describe it as a transforming tool that I think everybody should be trained with. I mean, when I heard, no, I'm not going to say that. Because it's somebody else. It's Cordilleras, they're doing it too. So, yeah.
That was awesome.
That was